Alrighty, good morning, everybody. I call this meeting to order at 9:03 a.m. We will proceed with roll call with Mr. Secretary Ricardo Lopez.
Thank you. Good morning, everybody. Staff Senate, I will now begin roll call. Please indicate your attendance in the chat or out loud through voice. Antonio Alvarez, Armando Ponce, Blanca Davila, Karina Alcantara, Carlos Ayala.
Aye.
Thank you. Dina Lopez, Edna Munoz, Liz Reyes,
Aye.
Stella de la Garza, Francine Perez, Graciela Abrego, Jake Gonzalez, Jeanette Garcia, Juan Pablo Calderon,
Aye.
Krista Marroquin, Leslie Orozco Zarate, Manuel Vidal, Maria Perez, Matthew Lerma, Matthew Munkus.
Aye.
Thank you. Mauro Uriegas, Mara Garcia, Nicholas Swanson, Ofelia Jimenez, Omar Nedzelski, Ruby Sanz, Santiago Martinez, Stephanie Trujillo, Todd Holland, Victoria Lozano, and Yesenia Carter. All right. Mr. President, quorum has been established.
Thank you, Ricardo. Good morning, everyone. Happy Thursday. Welcome to our Staff Senate General Meeting for the month of March. It's wonderful to have you all here with us this morning. I hope everyone made it to work safely this morning due to some rain that we had. We will begin our meeting with new business. Is there a motion to table the April 2026 meeting minutes?
I move to table the meeting minutes for April 2026.
Is there a second?
I second.
All those in favor, please state aye in the Teams chat. All opposed? Any abstentions? Great. The April 2026 meeting minutes have been tabled. We will begin with our first guest speaker for today's meeting, Dr. Giselle Guerrero. Dr. Guerrero, are you here with us?
Yes, thank you so
Hi.
much.
Awesome,
Hi.
thank you. You can go ahead and you can begin.
Okay, awesome. Thank you guys so much for having me. Good morning. My name is Giselle Guerrero. I'm going to go ahead and start sharing my screen. I am a dermatologist with UTRGV. I just started, and so May is Skin Cancer Awareness Month, so really excited to talk to you guys about this today. Can everybody see my screen? Okay, awesome. Perfect. And so I'll just go ahead and dive right in. So I was actually born and raised here in the Rio Grande Valley. I was born in McAllen and raised in Mission. I graduated from high school, and then I did a lot of my schooling in San Antonio in the University of Michigan. And so it's really good to be back here, home in the Valley, close to family. I missed a lot of the great food, of course, and being close by. And so things that are near and dear to my heart are patient education, prevention, and increased access to care. So I'm really happy to be here at UTRGV, where I know that aligns with a lot of our goals. Oh, okay, you guys can't see
Dr.
it.
Gooder. Yes, I think something may have happened.
Let me go back.
There we go.
Okay, can you guys see that?
Yes.
Okay, perfect. So this is just my first slide. And so, yes, I just had a picture of my husband and we were training in Michigan, and then he's actually from Edinburgh. We met in college, and we have a daughter too. So it's been great to be back home. So just diving right in, why skin cancer matters. So skin cancer is actually the most common cancer in the United States. About 1 in 5 people will have a skin cancer diagnosed sometime in their life. The good news is that most skin cancers are very highly treatable when detected early. I tell a lot of my patients when I'm finding skin cancers on them that it's not a reason to lose sleep, and it's great that they're there in clinic and that we can take care of it. The one skin cancer that a lot of people hear or know about is melanoma. And that one gets a lot of attention because that one in particular can be deadly if the diagnosis is delayed. And so we're going to go over some warning signs that are subtle and easy to overlook, and when you should go see a dermatologist. And so there are lots of different types of skin cancer, but the large majority will fall into one of these 3 groups. The most common by far is basal cell skin cancer. That one often appears as a pearly pink bump anywhere on the body. The most common places are usually anywhere that's gotten some sun. So the face, the upper chest, even the back. And that one is very treatable. I tell patients they're more annoying than anything. They're not so worrisome health-wise, but they are spots that don't heal up and they don't go away with creams and things like that. Usually someone will say, I've had this spot for a long time, but it doesn't seem to go away with any creams or anything. Another common type is a squamous cell skin cancer. That one usually tends to be crusted, scaly. And then that one can be a little bit more aggressive if it's untreated. Sometimes people will have swollen lymph nodes, or that one can cause a little bit more bleeding. But the good news is that one in general too is very, very treatable. And both of these are very much tied to sun exposure. And then there is melanoma. That one will often develop from a dark lesion or a changing mole. That one is really important that we detect early, because if we detect a melanoma early, the treatment is very straightforward. You cut out the lesion, you have stitches, and then I like to tell my patients your melanoma chapter is closed, and then you are on cruise control, which means getting your skin checked regularly. Now, this one, like I was telling you, gets a lot more attention because this one can spread to lymph nodes, and if left untreated for a long time, it can spread to other parts of the body. That's why it's really important to just know some of the warning signs and get a baseline skin check and have an idea of what to look out for. And so some warning signs and when to seek evaluation. One of my favorite ways to kind of conceptualize this is I tell patients to look for an ugly duckling sign. So just a spot that just stands out from the crowd. And so getting, doing your own skin checks and kind of knowing what your baseline is really important, because the more familiar you know your spots, the more likely that if something is out of the ordinary, it'll just kind of raise a red flag to yourself too. And so any new or changing mole, people make moles for quite a bit. About the average age that people stop making moles is about 35 or so. So it's a little bit later than most people realize. And so that's about the average. Some people make moles a little bit later, stop making moles a little bit earlier. After around that time, you start making more of the age spots, and those are a little bit different. But moles, as far as like dark, pigmented spots that are flat, like if you close your eyes, you can run over your finger with it, those you should stop making at around 35. And any spot that just, bleeds randomly, it crusts up, or just doesn't heal, or is growing quickly, any of that stuff is reason to come see us or to have us take a look. And so there is the A, B, C, D, E's of melanoma that can basically is the ugly duckling sign in a little easy way to remember. The A is for asymmetry. So if there's a spot that if you were to try to fold it, it wouldn't fold perfectly in half. B is for border. The borders don't look very symmetrical. C is color. If there's multiple colors in there, D is diameter. It's just like a really big spot. And E is evolving, which is probably the most important one, just a spot that keeps changing. And so all of this to say is that skin cancer tends to be a spot that just stands out from the rest. So that's why it's really important just to kind of know your skin too in general. Prevention pearls. So what can we do to prevent skin cancer? So using SPF 30 plus is a great way to start. Nowadays, there's a lot of moisturizers that have SPF, which is really nice. So if you find a moisturizer that you like, the number that you want to be aiming for is 30 plus. There are a few out there that are 15, and obviously anything is better than nothing, but if you really want to be protected, aiming for 30 for just everyday use. And if you're going to go out and enjoy the beach or something like 50 is even better. And you still want to be using it, even if your makeup has some SPF, because usually the SPF in makeup is not enough. Sun protective clothing is wonderful. That's hats, long sleeves, anything like that that just prevents sun exposure is really great too, because anywhere that's already being covered is a spot that you don't have to worry about. The sun's peak hours are between 10 a.m. to 4 p.m. And so as much as possible, if you can maybe have an event around that or just be mindful during that time that you might have to be reapplying a little bit more often or seeking shade is something to keep in mind. My recommendation is to avoid tanning beds, period. There is no such thing as a safe tan or a healthy tan. A tan in general means that the skin has been damaged. And so I always tell people that if you want it to get like a little bit of more color, there's a lot of great like the tanning lotions and things like that that you can just put on your skin instead of getting UV rays. And then just like we talked about, performing self skin checks is absolute gold. You don't have to do it all the time. Just every couple of months, just using like a mirror or a handheld one and just getting familiar with what kind of spots your body likes to make. So if anything ever comes up, you've done it enough times to know that, hey, this is outside of my baseline. This is an interesting photo. This is a truck driver that is 69 years old. And so truck driver basically their entire life, and you can see the difference in where the sun hits on the left side of the face compared to the right. And so just cumulative sun exposure can lead to lots of different skin changes. And so where are we located? So we are at Centerpoint Drive here in Edinburgh, Texas. And we see a variety of different concerns. We see medical dermatology, so anything like acne, eczema, rashes, anything hair and nails. Pediatric dermatology, we see patients of all ages, so newborns all the way into adulthood. And then we see skin cancer and we do surgical dermatology here. So if anyone is diagnosed with a skin cancer, we talk about treatment and we do excisions here too. We have a couple of cosmetic services that are available right now, also looking to expand that in the future too as well. And here is our phone number also, and always happy to help schedule an appointment if anybody has any questions about anything too. So some key takeaways. Skin cancer is common and often preventable. Early detection 100% improves outcomes. Changing or non-healing lesions deserve evaluation, and sun protection matters at every age. And here's a nice little graphic of somebody just giving themselves a general skin check just to check if anything is out of the ordinary. And I'm happy to take any questions if anybody has any. Otherwise, thank you so much for taking the time to listen to my presentation. And I'm always available like Teams or email or anything that you guys need.
Thank you, Dr. Guerrero. This is very helpful, very, very helpful information. We do have a couple of questions in the chat from
Okay,
staff
awesome.
here. One of them is, does one need a doctor referral to make an appointment?
Great question. So it is dependent on your insurance. Here at UTRGV, our team is really great. So all you have to do is call, and once you give their insurance information, they can let you know if you need a referral. Some insurances don't, and some do. So it just depends. But you can figure it all out with a phone call pretty easily.
Awesome. And what type of cosmetic services do you guys have?
Yes. So right now we're doing like mole removals and skin tag removals and like removals of small cysts and things like that on the face. We don't have any lasers right now or chemical peels, but we're hoping that that's going to come in the future too. So once that's available, hopefully we'll be sending out like a message for people to come in.
Awesome. And is there a location in the Lower Valley?
Right now we have just the Edinburgh location right now. We're here throughout the entire week. And so we'll definitely let you know if that changes. So it's me in Edinburgh right now, and then Dr. Vegas is in Harlingen.
Awesome. And just a couple last questions. Do you do body scans for moles and skin spots?
Yes, absolutely. Very happy to do that too. Mhm.
And another one, who do we, or I think this one is how do we develop moles at a young age?
Now, yes, so some moles, there's a lot of different flavors of moles. I like to tell patients that, oh, this mole is kind of like a cousin to another one. Mole is kind of like a very blanket, a term for a lot of spots that we make on our body. There are some moles that are called congenital nevi. Nevi is the medical term for mole. Those are moles that can come up either at birth or shortly afterwards or in kids. So those have different pigment patterns to them too. So those are more due to genetics and DNA and less due to sun exposure also. But there's a wide spectrum of them too, which is why I tell people it's a good idea just to get a baseline skin check so you can kind of figure out which ones are what or which ones to keep an eye out on for.
Awesome. What is the difference between a chemical and mineral SPF?
Oh, I love this question. So, uh, both are great and they offer sun protection. Mineral sunscreens in general tend to be better for people with more sensitive skin. In general, I will actually recommend mineral sunscreens more across the board if you can tolerate them on your skin. They're actually really great for also like pigmentary changes. So for people who have like darker spots or looking to kind of even out their skin tone more, they tend to be a little bit more tinted and they block a little bit more of the UV spectrum. And so they offer broader protection. So you'll hear a lot of dermatologists recommending mineral sunscreens for like things like melasma, like or hyperpigmentation. And so they're great to use and they tend to be more well tolerated as far as like for people who have very sensitive skin. There is some evidence too of anti-aging properties for mineral sunscreens, and that's probably more likely due to their broad array of being able to block out other types of light too. And so if you have the choice, usually I will say a mineral sunscreen is the better option, but both are great too.
Awesome. Just a couple more, and then I know they're popping in the chat. So if you have some time after we're done here, if you want to go ahead and take some, but just a few more so that we can keep track of time. But do you have a preferred sunblock for the face?
Yes, so I personally CeraVe and Eucerin just came out with mineral sunscreens that I really like. I like the ones that have a little bit of tint because, like I was saying, that tends to help block some of the other light that we see, like just the normal everyday light, like in our offices and stuff like that. And like I said, the mineral tinted one helps a little bit of anti-aging too. So CeraVe, Eucerin are really good. Elta MD is another good one that feels really nice on the skin, is a little bit at a higher price point too, but is nice for everyday use.
Awesome. Let me see here. Maybe we can do one more. What about bags under the eyes?
Oh yes. So that one usually requires like a I usually call it like a multifactorial approach. There's different things that we can do skin-wise. So there are sun protection is going to be a big one. Hydration is also a big one for spots under the eyes. And then there are certain creams that we can prescribe or over-the-counter like skin regimen that can lead to like a little bit more evening out the skin tone and kind of if some people have any underlying inflammation there, help treat that too. So it's a very individualized approach, I would say. And everybody's different as to what ingredient or what medication might be best for them. I usually tend to ask a lot of history too, like how long has this been going on for? Like, does the spot get inflamed? You know, how are what kind of medicines are you taking and things like that? Because a lot of stuff can contribute. But the good news is there are different treatment options for it too, and not all of them are surgery. I feel like some people think that the only way to treat it is surgery, but there are other ways to do it too.
Awesome. There's just a few extra ones, but I will ask, is it possible, maybe I can get with Christina, the presentation you shared with us, is it possible to share that with us if you can?
Oh,
If not,
yes.
I can arrange with Christina, we can add it here later and send it to our staff. I know there's some asking to share with families or to share with anybody that may not be here today as far as staff, but also to their families too.
Yes.
Yes,
Of
she,
course.
Jake, she can send it to me and I'll send it over to you.
Okay, perfect. Thank you, Christina.
Mhm.
Thank you so
Yes,
much.
you're welcome. Mhm.
Awesome. Well, Dr. Guerrero, this was great information. Thank you so much, especially highlighting that it's the month for, skin cancer, melanoma detection and prevention month. But there are a few other extra questions on the chat here that are related to concerns about moles. If you are able to, you're more than welcome to respond to them here in the chat. If anybody needs any questions or anything like that, the address is also placed in the chat too. Someone was very gracious to place the chat there as well as the telephone number directly to the office. So I
Oh,
think
yes, I
that,
should have left that
Yes.
there too. Thank you for doing that. Awesome.
but I think that's it. Thank you so much. Really appreciate your time. Thank you.
Thank you guys. Have a great day.
Thank you. Alrighty. Now we can move on with our next presenter, Ray Bettis. Ray, are you here?
Yes, I'm here. Hello. Good morning, everybody.
Good morning.
All right. So thank y'all for having us. I'm Ray with the Benefits Department, everybody's favorite department in HR. So with annual enrollment coming around, we just wanted this opportunity to present a lot of information regarding the benefits, just refresher and a couple of features that we just wanted to, let y'all know about. So give me a second. I'll go ahead and share my screen here real quick. All right, perfect. Is everybody able to see my screen? Awesome. All right. So first slide here, just wanted to give you all some information on our benefits landing page for human resources. This is where you can find a lot of the information that I'll be presenting to you today. A lot of great resources that you can find on our website. Just click the benefits tab up here on top, and there'll be a lot of great links that you can utilize. So as I mentioned earlier, we wanted to go over some information with annual enrollment right around the corner. So a couple of questions that we always get throughout the year is, I want to make changes to my benefits right now. Unless there's a qualified life event, changes can only be made during the annual enrollment period, which is going to be from July 15th through the 31st. And any changes that you make during that enrollment period take effect on the first of the academic year, which is September 1st. Outside of the annual enrollment period, you can make changes if there's a change of status or a qualified life event, which gives you a 31-day special enrollment period to make those changes if there's an eligible event, which can be like a marriage, divorce, birth, adoption of a child, God forbid, death of a child, or if you have coverage elsewhere or dependent has coverage elsewhere and they lose that coverage. Those are some examples, some life events where you can make changes during the year outside of the annual enrollment period. If there is no event, then you would unfortunately have to wait until the annual enrollment period. That's done through the MyUT benefits portal. So, where do you enroll? A lot of questions that we've been getting recently are, employees going into PeopleSoft and saying, I can't make changes to my benefits, I can't add a dependent, but because PeopleSoft is not where the benefits are done, that is actually through the MyUT benefits portal, which you can find in your applications when you log into the myut.rgb.edu. It'll have the applications. You'll click the My UT benefits. It'll have you sign in one more time, and then it'll take you to your benefit screen. So right now, since we're out of the annual enrollment period, normally you'll just see edit your benefits. That's where you'll make your changes for a qualified life event. But come July 15th, it'll say get started. That's when you'll be able to make those changes for this upcoming year. What's included in our plans that are offered? So the first one is the medical. So that's the basic coverage plan. So that's available to full-time benefit eligible employees and part-time benefit eligible employees. So if you're a full-time benefit eligible employee, that means that you're working at least 20 hours a week and you have an assignment of at least 4.5 consecutive months, in which case the medical plan is no cost to you, which I'm sure y'all are aware. But if you are adding dependents, there is a cost for adding dependents on the plans. So if you're planning on adding a dependent for the first time during this upcoming annual enrollment period, just keep in mind that there is an evidence of eligibility needed, which is just like a copy of the birth certificate if you're adding one of your children that's not yet age 26, or if you're adding your spouse for the first time, would be a copy of the marriage certificate. So the basic plan includes a basic life insurance, and basic accidental death and dismemberment to cover for like final expenses such as funeral costs, or if you want to just leave money to your loved ones. Something that is available for our medical plan as well is the Blue Cross Blue Shield mobile app, where you can find your ID card. You can view your benefits, deductibles, your costs, all those good things, find providers, set up appointments, a lot of good things you can utilize with that mobile app. That would be the medical plan, just what's included. And one thing that we do want to let y'all know of is how to maximize your health coverage. So your medical plan has different in-network, out-of-network costs. One way to maximize your coverage is if you were to see a provider within the UT Health Network, that lowers your co-pays, and it lowers your co-insurance amount after you meet your deductible. If you go to a Blue Cross in-network, your co-pays are slightly higher, and your coverage is a little bit higher at 20%. But this is one way that y'all can just, again, you maximize your coverage. You know, if you have a provider that's in a UT Health Network, you're going to lower your co-pays. If you need to get surgery done, you know, you use that UT Health Network, you're going to lower your co-insurance amount. So you're going to be responsible for less costs as if you go into a Blue Cross Blue Shield network. But, you know, it's up to y'all's preference. You know, we're never going to tell you you all have to see this doctor or that doctor. This is just one way to maximize your coverage to utilize your benefits. What's also included is your prescription drug plan. So for the prescription coverage, you do have a $200 deductible. So you're responsible for the cost of the medication after you, until you meet your deductible. After you've met it, then you do have your set co-pays, which range from $10 to $60 for a retail pharmacy network. If you utilize the home delivery pharmacy, you get a 3-month supply at a lower cost. So that's one way to save on costs for your medications. So an example is your generic medication for 30-day supply, it's a $10 copay, but if you utilize the home pharmacy, that's a $20 copay. So essentially you're getting, you know, 3 months of medication for the cost of 2 months. Also, the mobile app, that's something that is available to you. That's one way to check to see if certain medications are covered in the plan and to see how much the copay will be for that medication. So we do get calls sometimes, you know, hey, Ray, I want to know how much, you know, this medication is, or I want to know if it's covered. We don't have an exact formula or formulary for medications. So this is one way to cut out the middleman, should I say. That way you can just type in the medication that you're being prescribed, and it's going to show you if it's covered. If it's covered, it's going to show you if a prior authorization is required, or, you know, how much that copay is going to be. So that's information that's available at your fingertips. So it's a great tool to utilize. I have all these mobile apps and I use them as much as I can. So it saves a lot of time. You don't have to be calling, waiting online to hold for somebody at Express Scripts or at the pharmacy. You can just use that mobile app and find that information that you need. One feature that is included in the medical plan, this is a really, really great feature that we wanted to really touch base on with everybody, is the MD Live. This is at no cost to you. If you ever talk to me here at the benefits office, you'll really ever hear me say something is free, especially when it's medical, because it's not free, but it is no cost to you. In your medical plan, it has a $0 copay. So you can always utilize this service and it's no cost to you. If you're traveling, you're on vacation, you're out of the state of Texas, you don't know, if there's any doctors that are in network and it's a non-emergency, you can always log in and set up an appointment. You don't even need to set up an appointment for some issues. If it's a non-emergency, you can always go on there, see a doctor virtually. They'll provide you a prescription, they'll like seeing a doctor in person just over the phone. So again, this is one way to utilize that tool when you're out of the area and you're not sure whether you're in network, because you don't want to go to a doctor's office, find out that they're not in network, and be responsible 100% for the cost because the plan's not covered in that area. So this is a great tool to utilize. A lot of people here in the office do utilize this tool. A lot of times we're here at work, we don't have times to set up doctor's appointments or go out and leave right away. You can always use this tool, set up, speak to a doctor right away. It does also offer other features as well, such as behavioral health services. That one does require an appointment, but you're able to see a doctor regarding those issues for treatment for non-emergencies, physician expertise, primary care, pediatrics care as well. And it's open 24/7, 365 days a week. So again, this is a really, really great tool, guys, to utilize. It's not a very hard process. It's actually very easy steps just to log in, enter your information, and then you're waiting in line to see a doctor. So if you ever need to utilize this, you're in a jam, you're in a hurry, you don't have time, take advantage of this feature. Another thing that we want to let y'all know about as well is the UT Select concierge number. This is a 1-800 number that is dedicated for the UT Health group. So they'll help you, guide you, finding diagnosis, finding doctors, finding specialists that are in your area. You can always call this number. Hey, I'm gonna go see this doctor, for this scheduled appointment. I want to know if they're in network, and they'll let you know if they're in network. Again, that way you don't go to a doctor that's out of network, find out that last minute, and then have to reschedule an appointment or end up being responsible for that cost out of pocket. So this is a great service that's available to y'all. We use it here as well whenever we have to find cases or help employees with certain cases. We act as y'all's liaison, and we'll contact that concierge number as well. So they offer great service. They're there to help y'all. They help with a wide variety of issues, mental health experts, manage stress, substance abuse, answer problems if you have questions on a claim, you want to know what your deductible is, or if you've met it. That's one number that you can always call, and they'll be very helpful with you in that regard. Another thing that's available is the Blue 365 member discount. Because you're enrolled into the medical plan, that is something that y'all can use. We get a lot of questions. Are gym memberships included in the medical plan? Unfortunately, they're not included in the medical plan, but with the Blue 365 discount program, you can find discounts to hundreds of gyms that provide discounts for that monthly membership, as well as other necessities as well, like grooming, health products that you can always get discounts on, grooming products as well. It's a great tool to utilize. I've used it to get, for dental care as well. A lot of great discounts on their pet insurance also. Also offers the 24/7 nurse line number, where you can contact the nurse line number. You don't know whether your symptoms need emergency treatment, you can always call that 24/7 nurse line number. They'll guide you in the right area. They'll provide you information. They'll let you know, okay, yes, what you're experiencing does require emergency treatment, and refer you to an emergency room. So a lot of great features that are included in the UT Select Concierge number that y'all can utilize. This information is always available on our website, or you can always give us a call and we'll direct you where to locate that information as well. Next is the dental plan. There's 3 plans that are offered that y'all may or may not be enrolled into already, which are the 2 PPO plans and the HMO plans. The rates vary starting from $8.71 to $183.30, depending if it's just yourself or if you're adding any dependents. So these are some rich benefits that are available to you just depending on the services that you need. There's 2 plans that are available on the PPO. They cover the diagnostic, the periodontic, the basic services. So it breaks it down into 3 different tiers. If you're one that you don't utilize the dentist coverage that much, you mainly go for the cleanings once every year. The select plan may be the plan for you. You covered at 100% for your preventative, and then 80 and 50% for those basic and major services after a $25 deductible. The high plan or the select plus plan, you're covered at 100% or 80%, and you have more coverage in the year to utilize. So it's more than double right there. It's a $3,000 annual coverage. That's the most that the carrier will pay in claims in the year. So if you need a lot of coverage done, you need some crowns, dentures, implants, you might go with that plus plan to maximize your coverage. The HMO plan, this one, there is a copay for every service that is rendered, so it doesn't break it down into tiers like the PPO plans, but it is at a lower cost. One thing that you do want to keep in mind with the HMO plan is that the dentist that you select in network, that's your primary care dentist. You're not able to go outside of the network, and there's I wouldn't say a limited number of dentists in the area, but it is a small number. Last I checked, it was about 50 dentists total in the valley that took the HMO plan. But if you're just really going for, routine exams, cleanings, and your dentist is in that network, it's one way to save you some premium on that cost. It is a good plan. It just breaks it down into 3 services. There's no deductibles required. Just be mindful of the dentists that are available. You can always go into the website and you can locate the dentist, enter your zip code, enter the network, click find a dentist, and you'll find as many dentists in the areas that are available that you can always try out. You can always download the mobile app as well. You always hear me pushing that mobile app because the mobile apps is where you can find your ID cards. We always get calls, hey, I didn't get an ID card, or, I lost my ID card. If you have that mobile app, you can always have access to your ID card digitally. That way you can provide it to the provider's office, and you can always request a new physical ID card be mailed out to you as well on those mobile apps. Next is the Vision. For the Vision, there's 2 plans that are offered. There's the basic plan and the plus plan. Both of them have a $35 copay. Both have allowances and coverage for the lenses. It just depends on what your needs are. So if you're looking to have more coverage for your frames, the Superior Plus plan is going to give you that $25 more in additional coverage. It's going to give you additional coverage if you need progressive lenses. And then the standard copay, the standard prescription lenses are covered in full. They're included with that $35 copay. But if you're going to be getting those extras, the plus plan would be the way to go for those polycarbonate lenses, the anti-scratch coating, the ultraviolet. It has some additional options for the plus plan. But if you just need, some readers, or just going in for contacts, maybe, the Vision basic plan may be the way to go. Again, we can't direct y'all or tell y'all what type of plan to take. It just depends on your needs. But those would be the 2 plans that are available to you guys. Next is the life insurance. So the medical includes a life insurance, but if you have a voluntary life insurance, that one is an additional cost. During the annual enrollment, that is available to y'all to enroll into as well. If you're going to be increasing the amount or if you're adding it for the first time during the annual enrollment, there is an evidence of insurability that is required. That is a health statement or an application that you would fill out digitally on the MyUT benefits portal. If you're approved, that'll take effect. If you don't get approved, then you won't be charged for that premium, or it'll revert back to the premium that you had before if you already had one in place. But the life insurance, this is a good policy to have. It's a very minimal cost because we're a group insurance plan. So if you're looking to, secure your financial future for your loved ones when they pass away, because you don't want to be a burden to them, when you pass, with all those costs that build up when it comes to those final expenses, this is a great plan to have. That way they can have some type of funds to pay for those expenses, or if you just want to leave money to them because maybe you're the sole income provider. So it's a great plan to have. You can have up to 10 times your annual compensation or up to $2 million, whichever is less. If you're adding your spouse, you can increase the life insurance for your spouse up to $40,000, and for your children is $10,000. So that one, life insurance, great plan to have. There is another option, which is the accidental death and dismemberment. This one does not require a health statement or an application because this applies to accidents. So if you pass due to an accident, that gets paid out to the beneficiary. If there's a dismemberment, like a loss of a limb, then a percentage gets paid out to you based on the policy amount that you have. So this one you can enroll up to 10,000, or starting from 10,000 up to 10 million, or 10 times your annual compensation, whichever is less. And then the spouse, you can have up to 5 times the employee's annual compensation, or you can include your children for 10,000 as well. Next are the disability insurances. So disability, this is when you're out of work due to an illness or an accident, and it's there to help you supplement your missing income while you're not working. So if you don't have a lot of sick time saved up, that's where short-term disability is going to help you. Or maybe you do have sick time, but it's going to be a long-term disability. Long-term disability is there to help you supplement that missing income, pays you 60% of your salary after a 7-day waiting period, or after you've exhausted your sick days. So if you have 6 months worth of sick days and you're on the short-term disability plan, the disability plan is not going to help you because it only pays up to 22 weeks, pays up to 22 weeks, but you have to exhaust that sick leave first. But maybe you don't have any sick leave. This is going to help you because after those 7 days, it's going to pay you your 60% of your salary after that 7-day waiting period up to 22 weeks. If you're going to be out longer than 22 weeks, that's where long-term disability kicks in and pays you after a 90-day period. So after the short-term ends, this one will pick up and pay you on a monthly basis up until age 65 or up to a certain time, depending on when you get hurt. So if the older you are, later in life you get hurt, it's going to pay a lesser amount of time. So if you get hurt at age 60, it's only going to pay up to 5 years. If you're at 69, it's only going to pay up to age 70, but not less than 1 year. So this, again, it's a great benefit to utilize if you don't have a lot of sick time. That way, you're not missing a paycheck when you're not working due to that illness or due to that accident that happened outside of work. Long-term, this one is another long-term disability, but this one is available to full-time employees who are senior administrators, scientists, physicians, who are directly associated with the UTRGV School of Medicine or were hired or appointed to their position for a period of 4.5 months or a year. So this one's a little bit different. These are for those positions that are available. This one you have an option of selecting either 90 or 180-day waiting period. So just take that into consideration. 180 days, that means 6 months of not being paid before the long-term disability kicks in. So if you do have this one, make sure you do have that short-term disability or you have that sick time accrued so you can cover that time without working. UT Flex, this is a benefit that's available to everybody as well. There's two options, which are the healthcare reimbursement account and the dependent care reimbursement account. This is a way to set aside your money for as a pre-tax benefit for certain out-of-pocket expenses when it comes to medical services or when it comes to dependent daycare. It does go based on a use it or lose it basis. So if you do, or if you're starting out for the first time this upcoming year, make sure you start out low because you don't want to put money in there that you're going to forfeit. I don't know about y'all, I don't like throwing away money. So you kind of want to budget yourself when you're using this for the first time. If you've had it in the past, you know, you already should know your budget, hopefully. But just keep that in mind. It is use it or lose it. You do have until August 31st to accrue any expenses when it comes to dependent care. So if you didn't use those funds September 1st, you know, you lost that $200-300 that you had extra in there. For the healthcare reimbursement account, there is a grace period up to November 15th to incur any expenses for the prior plan year. And you do have until November 30th to file that claim for those prior expenses. So there is a grace period when it comes to the healthcare FSA. The difference is that the healthcare FSA, that's for your medical expenses. Sometimes we do get calls, you know, hey, I'm trying to use my dependent care FSA, you know, for my child at the doctor's office, but they're saying it's not working. Well, that's because the dependent daycare is for daycare expenses only. So it's to, if you have a child that's attending licensed daycare, maybe you have your spouse is an adult daycare. That's where you can, that money is for. You put that money aside for the as a pre-tax benefit, and then you get that reimbursed to pay for those expenses. The healthcare reimbursement, that is for you and your dependents. So you, your spouse, your children. If they're not on your medical plan, you can still utilize that for them as well, as long as they're not yet 26 and they are your immediate dependents. So that helps cover for medical, dental, or vision related expenses. So if you have money, you get a lot of prescriptions and you have money to pay at the doctor's office, you can utilize that FSA. It lowers your reported income at the end of the year, and it puts you in a smaller tax bracket so that, you know, you save on your paycheck when utilizing that benefit. So again, the healthcare reimbursements for any medical, dental, or vision expenses, dependent daycares for daycare expenses. The mobile app is something that's also very good to use. I saw a question earlier, somebody asking about if some type of sunscreen was able to be used for FSA. You can always download this mobile app for the Inspira. In that app, you can search what are eligible expenses under the FSA coverage. So if you have the name of the prescription, you have the name of the product, you can always type that in there and it'll tell you whether it's FSA eligible or if it's not. So again, great tool to utilize on that mobile app. There is a maximum of $3,300 for the plan year for this year up to for 2026. For the healthcare reimbursement, dependent daycare is $5,000. That may change next year. We won't have that information until the enrollment period, but just keep an eye out for that as well. Usually they do increase that amount, but for this year it's at $3,300. Retirement, everybody here on this call is enrolled into TRS or ORP. This is the state mandated retirement plan options. Sometimes we get calls, can we increase this amount? Can we stop contributing to this? These you cannot alter or change in any way or form. If you are enrolled into TRS, you're contributing 8.25% of your income up to $350,000 of your annual income in the year. UTRGV contributes another 8.25%. If you're RP eligible, that depends on your assignment, your position. If your position is eligible for RP and you enrolled in that 90-day window during your initial enrollment, you're being deducted 6.65% and the university contributes 8.5%. And again, these cannot be altered or changed in any way, shape, or form. But that'll lead me to the voluntary retirement options. So if you do want to increase your retirement options or contributions, another way is through the voluntary retirement plans, which are the UT Saver TSA and the DCP, also known as the 403B and the 457. These are both available in pre-tax and Roth options as well, which are a post-tax deduction. You have an annual contribution limit of $24,500 in the year. If you're 50 or older, you do have a catch-up contribution amount of $8,000, which would put you at $32,500. Or if you're 60 or between the ages of 60 and 63, it's an additional $3,250. So an annual catch-up of $11,250. The difference between the traditional and the Roth is the tax implications in the future. The traditional, that's a pre-tax benefit. So when that one, when you are retired and you're eligible to withdraw those contributions after age 59 and a half, you're subject to the normal income taxes. But if you contribute to the Roth option, and you're 59 and a half, you've had the 403B open for 5 years, those are qualified distributions and not subject to the annual, the federal income taxes. So this is another way to save for retirement based on your needs. We can't tell y'all what to take. We're not financial advisors. So if you do have any questions on the voluntary retirement plans, we recommend to reach out to one of our authorized agents. These are the 5 providers, the authorized providers that you can contribute to, which are Fidelity, Voya, Lincoln, TIA, or Corebridge. As far as your employee deductions, you cannot contribute to any external providers that are not one of these 5 authorized providers. What you do independently, that's completely up to you. But when it comes to your employee deductions, it has to be one of these 5 providers. These are authorized reps. I always let employees know whenever they reach out, hey, I need to speak to somebody from TIA or Fidelity or whoever the case may be. I reference them to these contacts. These are authorized reps. They have knowledge on the UT system group. Because sometimes when you call, you Google the number, you call Fidelity, they might not have information pertaining to our group. Sometimes we do get employees that come in with information that was given to them incorrectly or wrong forms that are not authorized for us to sign off on. So anytime you have any questions, want information, contact one of these reps. These are our authorized reps dedicated to our group. They'll be able to answer any questions and help you, find the right financial plan available to you as well. This is our retirement manager page. So anytime you want to enroll into the voluntary retirement plans, you have to do that through retirement manager. There's no annual enrollment period for the retirement plans. There is a deadline of the 15th of every month to make contributions for the next paycheck. So we're already past May 15th. You can't make any changes for June 1st paycheck. The earliest will be July 1st. Also keep in mind that there is a minimum contribution limit of $15 a month. If you go lower than that $15 a month, you may get an email, you will get an email from me just to let y'all know, that needs to be updated. But just keep that in mind, $15 a month, annual max is $24,500 unless you're eligible for those catch-ups. Another feature that y'all have as benefit eligible employees, if you're full-time benefits eligible, is the employee tuition assistance program. So this is there to encourage y'all to develop your skills needed for your career, or just to increase your education. So it does pay for 9 credit hours per fiscal year. Just keep in mind that it's 1 course per semester. So unfortunately, you can't take 4 classes in the fall and have 3 of them paid, unfortunately. So it just pays 1 course per semester. The Employee Assistance Program, this is a very, very good tool that's available for y'all. It's free. It's no charge. This one is free. It's no charge to y'all. This one is a confidential program. There's no cost to you. That's available to you and your dependent spouse or children. You can always use this for counseling, for depression, anxiety, grief, bereavement, anger management, family counseling, financial advice, legal advice. This is a very, very great tool to use. A lot of times we look at everybody, we assume they're doing okay because they're smiling and happy and laughing, but we don't know what's going on, behind, closed doors, right? They may be going through certain issues. You want them to get help. You have a child, maybe they're being bullied at school. You want to get some counseling for them. You can always utilize this tool, this number, and get that counseling, no additional charge for y'all. It's confidential. They're not there to judge y'all. They're always there to help you guys. So it's a great tool to use. Whenever y'all need it, you can always reference this number. Hey, I have a loved one pass away. I need to speak to somebody. They're there for y'all. So if y'all ever have anything, you can always utilize this. It's something that's very, very touches home with me. So it's something that is available to y'all. You ever need to speak to somebody, whatever the case may be, you're not alone. You can always utilize that coverage. Another thing that's available as well is the discounts. As employees, we all have discounts that are available to us. Automobile services, electronic services, fashion, travel, hotels. You can scan this QR code or click this link. This presentation, I believe, will be made available to y'all as well. So that way you can utilize these links to find this information and take advantage of those Vaquero discounts. But that's everything that I have, guys. If I went too fast, I'm sorry. I was trying to be mindful of the time that was allotted to us. But we're here for questions. If you ever have any questions, you can always reach out to us through these different mediums, through email. Our representatives are myself, Teresa, in the Edinburgh office with our senior representative, Omar. And in Brownsville, we have our senior rep, Simi and Julie. So you can always reach out to us via email, through Teams, or you can always contact us to our phone. Whenever y'all have questions, we're here to guide you. We're here to help you. Sometimes, if we don't answer, we might be in a meeting or something, but we will get back to you. But that's everything that I have, guys. Thank y'all for listening, and hopefully this was information that y'all are taking it in, that you can utilize for the annual enrollment coming up. Any questions?
Thank you, Ray. I know some questions are already being answered while you were presenting from some of your HR colleagues, which thank you for that, Jessica and Omar. I'm looking here just to be mindful with everyone in the chat that if you have any personal questions related to anything on your side, just please make sure to contact the benefits office directly. I would not recommend placing them in the chat. The chat should just be used for just general brief questions. Ray, let me see here, just so we're just also being mindful with time. Is there a limited amount of sessions when using EAP?
For the limited sessions, sometimes some do have them. That's a good question. I'll have to research that. I don't see any, but if
Okay.
you want to, just go ahead and drop your email. I'll find that answer and I'll send that to you within the hour.
Awesome. And we have someone raising their hand, Laura.
I'm sorry.
Oh.
I'm sorry. I think I did that by mistake.
Oh, okay, no problem.
My apologies.
No problem, no problem. Ray, I think that's pretty much it. Again, if anybody has any questions,
Wrong link.
just be mindful that if you have yourself muted, please, thank you. Ray, I think that's pretty much it. We will, if you can go ahead and please share the presentation, that'd be very great, so that way we can share with everyone here in the chat. And of course, any information that you have directly that anybody can contact your office directly.
Yes, definitely. Thank you. And thank you all, everybody, for your time.
Thank you so much.
Thank you so much.
Alrighty, now we can go ahead and move on with our next guest speaker. Chris, are you here?
I am here.
So thank you, Chris.
For sure, for sure. Thank you for having me, guys. Let me share my screen. Can you guys, Jake, can you see my screen? Yes, alrighty. Good morning, guys. I'm here to share some quick overview of what we offer here at the Rec Center, specifically for our faculty and staff. As shown on the slide, faculty and staff can purchase a monthly or annual membership through our payroll deduction. That will be via PeopleSoft, which that rate is $22.55, or in person at our member service here at the Rec Center, with the option of $25 a month or $250 annually. With payroll deduction, you will be saving a couple of dollars. And if you do pay the annual one with $250, that will save you $50. So something that we offer here at the Rec Center, as you guys can see on the slide, there's a lot of amenities that we have. Some of the benefits would include, of course, full access to the fitness floor, our cardio areas, our courts, and all of our recreational spaces. We also have our group fitness classes. We have up two pools, actually. We have our leisure pool and our lab pool. And we do have our indoor our indoor track and our climbing wall. Now, for the summer, we do change our hours of operation. So right now, Monday through Thursday, we are open from 8 a.m. to 9 p.m. and Fridays 8 a.m. to 8 p.m. Saturdays we're open from 12 to 5 and Sundays will be closed. For the summer, this is very exciting because we're trying something new. We are offering our group exercise classes from June 1st to June 31st. And let me just show you guys that slide right here. So like I said, we are offering our classes starting June 1st all the way to July 31st. This includes Pilates, yoga, bar, circuit training, glutes and core, and we actually also have some boxing. In this case, we won't be offering for the summer, but regular semester we typically offer boxing too. Now, for the cycling fit, this is new. We will be opening at 6:30 a.m. on Wednesdays. And we'll be opening the facility, just the main entrance, so faculty and staff and our UREC members can have access to our first morning class at 6:30. So which will be a great opportunity for you guys to start maybe a new routine during the summer as things may be slowing down. This will be a great opportunity to try something new. We will only open our doors for a cycling fit class, again at 6:30, and we do have locker rooms here and showers. So you do work at 8, like most of us, you will have enough time to shower here and head to work. You will be here on campus already. So that is something new that we are offering. And if we do get a good traffic and good feedback, we're considering extending those classes to our fall semester. So keep an eye on that. I'll make sure to put this flyer on the chat. That way you guys have it as reference. Now, I did mention about our bar fitness class. That is something relatively new. It's a low impact exercise regimen that combines the elements of kind of like ballet, Pilates, yoga, and strength training. It's mainly focused on small control movements to start improving some muscle endurance, improve your flexibility, and just your overall strength. So if you have not tried that out, you guys have that option as well. That class starts starts in the afternoon, right after around 6:30, actually 6:30. So we do have those couple of options there. Now, going back to the rec, I just want to remind everyone that the rec is more than just a gym. I think there's a big misconception that we only provide weights and machines, but we do offer a lot of things here at the rec center. We offer, of course, fitness and wellness opportunities. We have our aquatics department here, intramural sports, which is an organized competitive environment that we host for students, faculty, and staff who are part of the rec family. We plan and coordinate tournaments, leagues for you guys as well. And these are open for, like I said, for students, faculty and staff, and alumni as well. So you guys know anyone who graduated from here, they also have that options to enroll at the rec center and also benefit from our programs and our sports, intramural sports that we offer here. If you have not visited us, we're right next to the Student Health Center. You shouldn't miss our building. We have 3 big pillars, glass pillars. And if you have not seen us or been here before, I encourage you guys to come by. Come by. Our staff members are well trained for anyone who just walks in and wants to tour a facility. You guys can come by and ask for a tour, and our staff will take you on a tour. Usually takes around maybe 10-15 minutes. It is a big facility. We want to make sure that you guys know all the things that we offer. Just like I mentioned, our climbing wall, our indoor track, elliptical machines. We got some fitness machines, free weights, racquetball courts, indoor courts. We have a softball field, outdoor basketball courts, and tennis courts as well. And those are some of the things that we do offer here. So if you have not come to the rec center, please make sure to check us out. You can also follow us on social media. On Instagram, we are UTRGB UREC, where we post a lot about our updates, our programming, our hours of operation, and anything that happens here at the rec. We do also have an app. A lot of people don't know that we have an app. Our app is basically just UREC on the App Store, and there you guys can find, there you guys will be able to get alerts and notifications, have more accessible links to our website where they can provide more information about all the things that we offer here. So, like I said, if you have not checked out the rec, give us a try. Give us a try. We do offer our fees relatively cheaper compared to other places, and it's just a little more convenient in your work here because you guys are already more likely coming to campus unless you work online. But I encourage everyone to give us a try. If you guys have any questions, let us know. Let us know. You can give us a call, or you guys can put them on the chat. Some of our programmers are here on our call too, in case you guys have any questions. And that concludes my presentation. Quick and easy.
Awesome. Thank you, Chris. Yes, I see Oscar, Annette, and Faye were answering some questions in the chat, but we still have some time. Does anybody have any other questions related to the UREC?
Oh yeah, my team is on it. Thank you, team.
Can you share, Chris, the visuals you had?
Of course, I'm about to send that over right now on the chat. Here we go. Or I cannot drag and slide. Let me manually upload it. But yeah, I'll put that on the chat right now. Oh, Siri turned on. She's still on. I'll put it on the chat. Let me see. But I think that's pretty much. Any other questions? Is there a trainer? Yes, trainers for hire. Actually, all of our JobX positions, vacancies are on JobX. So you guys know of anyone who might benefit from working at the rec center. We do hire a lot of students. Peak times, almost up to 100 students here. We're a big facility. We manage a lot of staff. So it's a great opportunity for students to get maybe a job on campus. That we help them a lot by accommodating to their school schedules. And also we have a lot of professional development for them. We have different positions for our students. Most of them start at an entry level, but we do have supervisor positions. We have graduate assistant positions, and we definitely love to see our students and staff develop throughout our semester. So we do provide that service for trainers too. So if you know anyone who might benefit from getting more experience in that field, we do have those positions here. Like I said, our vacancies are all on JobX. For the most part, we have already hired for the summer, but always keep an eye on JobX if you guys are looking for, if you guys are maybe want to know more about our positions here at the Rec Center.
Awesome. Chris, how do staff request the Staff Senate pricing if they go get a membership?
So for that one, when you guys log in through PeopleSoft, there you'll be able to automatically give you that rate through PeopleSoft. Now, if the other option will be to come here to the Rec Center and come here with our staff there in the front, they will hand you a form to fill out. And then once you guys submit your form, I'll make sure it goes to me, and then we submit that to payroll. And then you guys get a notification through payroll, I believe. And we keep all those documents here. By any chance, just let's say you want to cancel, you can always reach out to us, or you can reach out to payroll as well, where you guys can complete that cancellation as well. Good question.
Awesome. I believe, Chris, that's pretty much it. There might be one more here. No, that was just a suggestion. Thank you, Faye, for providing the link there for fitness outreach. Any last questions for Chris and the UREC team?
Jake, I want to go ahead and point out the question that was asked by Peter, or the comment. Are there
Yes,
any
thank you.
other options available at different campuses, Christopher, such as Harlingen or Brownsville?
Options meaning like memberships?
Memberships or other fitness options that are available to staff and faculty in those areas?
Got you. Yes, like on the slide on the very bottom right corner, we emphasize that for our people in Brownsville or closer to that area, the TSC Recreation Center also sells separate memberships. So then there they do provide, or we actually provide that information on our website too. The price is a little different, but we do facilitate the process with that. But at the end of the day, they're the one that manage those memberships. But they do have access to the rec as well, just like our students have access to the rec over there. But they just manage those payments. The payment wouldn't be with us. And then for Harlingen, we do host events in Harlingen. The big one that we have done in the past that we're gonna continue, it's our Die Hard race, which last year was our last one was. It was a great event. We had a lot of vendors, student organizations. We had a great turnout. It was the first time we did bids for the race. We typically have the mile run. We had the 5K. So definitely those are some efforts that we host there in Harlingen. We're also doing other efforts like our sports series, where we are providing intramural leagues on that side of the valley. Our faculty staff can also be part of, as long as they're just part of our rec family, by purchasing maybe a day pass or a 7-punch pass or a membership. They also have those benefits as well. And all those events, we typically share them on our links for our students and also on our social media. Keep an eye on Messenger. Our department tends to make those announcements through Messenger. So next time you guys see one of those emails, just scroll down, and more likely we'll have some of that information there as well.
Awesome. Thank you, Chris.
Thank you, Chris.
Yep. And I'm having a little bit of difficulty adding these slides on the chat. I'm not sure if it's not letting me. When I click the plus sign, maybe I'm doing something wrong.
Okay. No problem, Chris. If you like to, you can send them over to us, like to me if
Okay.
you want to, and we can
Yeah,
share
I'll send
them.
it to you right now.
Okay. Thank you. Awesome. Thank you, Chris, and thank you to all our guest speakers. We can move to the next part of our agenda, which is the committee reports. I'll go ahead and I'll hand it over to our communications committee, Dina or Maria.
And I just want to address Victoria's hand is raised, but we'll have public comments right after the committee reports, Victoria.
Thank you, Omar. I don't believe that maybe Dina or Maria are on the call. So we can go on to the next committee, Constitutions and Elections Committee.
Hi, for Constitutions and Elections Committee, we requested, or a request has been sent to HR for a list of active and eligible employees for this coming year's nominations. I think that's pretty much it for right now. I'll move it to business processes and staff support.
Good morning, everybody. I'm the chair for the Business Process and Staff Support Committee. We have sent emails to address some, I guess, suggestions that were brought up to invite the HR leave team to maybe present here on one of our meetings. We have staff that have questions about the leave program and how they can use them. Also sent emails to and invitations to attend to the department in charge of daycare services, both here and at UTRGV. Some staff is wanting to know more information about having daycare services here at the Brownsville campus, which were before provided by TSC. Other than that, I have no other updates. Just we'll, as soon as we get some updates, we'll get them to you all. And just keep sending in those suggestions and we'll address them appropriately. Thank you. I will now send it to the Staff Success Committee. Stella Garza.
Thank you so much, Carlos. For Staff Success Committee, we don't have any updates. We do thank you all for always being active and engaged. And with that, I'm not sure if we have can't remember the next person. Jake.
Thank you, Stella. It'll be me. So I will now move to open the floor for public comments and questions. And Victoria, I saw that you wanted to clap, but thank you for letting us know in the chat. Any public comments or questions? Irma.
Good morning, everyone. I don't know if Clarissa is on or not, but we just have an update on a new deadline for the ADA Title II digital accessibility compliance. It was extended for 1 more year. So our next compliance date is April 26, 2027. And we just want to continue to invite you to attend the Digital Accessibility Support Community office hours to continue the efforts to becoming compliant by that date. And today is DIR's 2026 Global Accessibility Awareness Day, and it's a statewide event in the state of Texas. And so I'm going to put some information on the chat. Thank you.
Thank you, Irma. Edna?
Oh, no, sir, I'm sorry. I wanted to click on the react, not on the chat, sorry.
No worries.
I wanted to take the time, Omar, to congratulate all the teams that participated in the Spring Forward competition for steps. UTRGV came in first, I believe, in our division. So I wanted to congratulate everybody who did over 2 million steps. Some teams did over 2 million steps within the week cycles. I think it was 5 weeks or something like that. And look forward to competing against everybody else in the fall. So better bring it because my team's coming for you. All right. Bye.
Thank you, Carlos. Rolando?
Well, Carlos just ruined my speech, so just ditto what Carlos just said. But thank you, everybody who did participate in the Spring into Forward Fitness Challenge. Yes, we did come in again in first place in our division. This was a team effort. Everybody at UTRGV, it just shows that, you know, we are Vaquero strong. So I am very excited for the fall into fitness. We have to keep this momentum going, and we can't have this trophy leave our campus. So can't wait for the fall into fitness challenge to come up. So V's up.
Thank you, Rolando. Any additional public comments or questions?
Okay, If there aren't any further public comments or questions, we will now move to make a motion to adjourn.
I move to adjourn the staff senate general meeting for the month of May.
Is there a second?
I second.
Is there any debate or discussion? Debate or discussion? Debate or discussion? All those in favor, please state aye in the Teams chat. All opposed, any abstentions?
Alrighty, thank you, everybody. The Staff Senate General Meeting for the month of May adjourns at 10:23 a.m. I hope everyone has a great day.
Thank you, everybody.